Hello, everyone. I'm Sonia Doi, the president of the International Spiritist Medical Association, and I have a great pleasure. It's my privilege now to introduce Dr. ELAINE Drysdale, my great friend, Dr. ELAINE Drysdale. Dr. Drysdale is a psychologist and a psychiatrist. She's a clinical professor of psychiatry in the School of Medicine at the University of British Columbia. She has worked as a psychiatrist for over 30 years in various medical settings, including over 20 years as psychiatrist to the Leukemia Home Bone Marrow Transplant Program in British Columbia and to the British Columbia Cancer Agency to palliative care programs. She has given numerous lectures to physicians and has spoken nationally and internationally on topics of psychiatry and cancer care, bone marrow transplantation, and near-death experiences. In clinical research study, she published in the New England Journal of Medicine, and she co-led a weekly group for 6 years for metastatic patients, helping women live fully while coping with dying. She was asked to give eulogies at many of the 35 funerals of the group members, which she considered an honor. She has had an interest for over 30 years in near-death experience, and she has taught about NDEs to patients, grieving families, physicians, and other healthcare professionals. In 2018, we invited her to give a talk in the Congress of the U.S. Spiritist Medical Congress, and was a really fantastic presentation that she gave. And after that, we also invite her to participate in several meetings at the International Spiritist Medical Association, and she gave lectures in 3 different countries in Europe. After those talks, she even went to Jerusalem to participate in the 4th World Congress on Psychiatry and Spirituality. She believes that awareness of NDEs provides a hope-filled new paradigm for many patients in coping with the anxiety of a life-threatening illness. So ELAINE has become a great friend of us, has now been known for several of our Spiritist groups, and is a great honor to have her in this event. So at this time, I would like to welcome ELAINE, and you have the floor. Thank you so much for participating.
Well, thank you so much, Sonia, for such a beautiful introduction. And it's really my honor to be speaking here at the first virtual International Spiritist Medical Congress. And it truly is an honor. And it's certainly an important time to have such a Congress when so many people are so concerned about the survival and spiritual issues in this time of the pandemic. So my topic today is about using near-death experiences to bring hope to the seriously ill and to the bereaved. Well, a few years ago, I had a patient who said to me, "I've never heard of anybody who died. Have you?" I was really quite taken aback by it. It seemed like a ridiculous question to me, as I'd worked on medical and surgical wards for decades in ICUs and in emergency settings. And I'd seen many people who'd been suicidal and many people who'd had cardiac issues and cardiac arrests. And I'd known many people who died even in my neighborhood during my childhood. And I had grown up thinking, well, that life was quite fragile, actually. But there have been people who have been in a state of death denial. But then along has come COVID and tremendous anxiety and change in people. As of this past summer, statistics told us that 1 out of 3 people in many regions were affected directly or indirectly by a patient with somebody with COVID. Now we know, or coronavirus, we now know that it's, I'm sure, much higher. People have been confronted by the realization that people actually die. It's not just a future fantasy or some kind of nightmare that could happen, but it does happen. People are faced with comforting frightened relatives or frightened patients. People are experiencing isolation, losses, depression, lack of purpose, suicidal thoughts. There's been increased drug abuse. There have been overdoses. The COVID pandemic has highlighted existential struggles that have existed for each human being at some point, but it has really awakened many to the concepts of illness, suffering, or death. Looking at statistics in the summertime, it was clear that the symptoms of anxiety have tripled over the past year, and depression has doubled. We know that suicide ideation of response of many people has doubled. And some groups are particularly affected, as my slide states, but I'm just going to move on. But particularly essential workers, unpaid adult caregivers have experienced increased substance use and elevated suicidal ideation. Looking at suicide rates, the World Health Organization has said that close to 800,000 people die every year due to suicide. It is probably much higher now. Why? We know that with COVID-19, there are many social factors that could increase the rate. There's isolation and loneliness, unwitnessed substance use, fears of testing positive, becoming a burden, social ostracism, grief. There are general mental health issues of depression, anxiety, and suicide rates that have increased. But we also know that there are biological factors that could be contributing. There are COVID-19 long haulers, we call them, who develop chronic conditions after having had the acute illness. These are likely inflammation related, and we know that when there's inflammation in the body, cytokine proteins are released, and they get into the brain and can cause depression and brain fog. So this is more or less a theoretical introduction to my talk, and I want to cover a number of areas in my talk about near-death experiences, but then I want to move on to some clinical stories. And the first part of the talk may be more cognitive, but the second talk, I think, will touch people's hearts more. So anyway, I'll carry on. So my own background, as I mentioned, that I have worked a lot with people who've had life-threatening illnesses, and I ran a group for 6 years with women who were facing dying and trying to live fully during that time. I learned a lot from those women in what was helpful and what wasn't helpful, and I was honored to be able to speak at the eulogies of almost all of them. But my work has not just been in the past. Just in the past month or so, these are some of the issues I've been dealing with. A despairing, isolated young man, Jackson, overdosed. He suffered brain damage and was being moved to a hospice. His mother asked me, "What should I say to him as he goes to hospice?" Later, after he passed on, or his transition, her words were, "My faith seems only theoretical. Can you help me in my grief?" Another patient whom I was referred knew she was dying. She was worried, atheist, and stated, "I don't believe in religion because I believe in science. What can I say to be of help?" And finally, a medical specialist colleague called me and said, "My cousin is terminally ill with cancer. She's frightened. She's not religious. What should I say to her? How do I broach the topic of an afterlife?" And in previous months, I've dealt with a young mother of 2 young daughters who were 5 and 7 years old, and she was suicidal from the depression associated with her chronic medical condition. A young father with relapsed leukemia and an 8-year-old daughter wanted to end his life to have control over his death. So these situations are very real. They're not theoretical. And these situations can happen in anybody's family. And you don't have to be a professional to try to help people. We can all give hope to others. As a healthcare provider for several decades, I want to share some of these clinical stories and to help you who may or may not be in the medical profession or other healthcare professions, so that we can apply the wisdom of near-death experiences to help others, whether it's in a medical setting or in some other setting. How can healthcare professionals or others broach the topic of an afterlife with dying patients? It feels awkward, doesn't it? Where do you start? You feel uncomfortable with the topic. We don't want to cause distress or open a can of worms. And sometimes people are concerned about the professional dilemma of not wanting to impose their own religious ideas on someone who is dying. So it feels fraught with complications, and sometimes it feels simpler to just avoid it, but then that's not helping anybody either. Spiritist individuals might feel confident in their own beliefs, but others might not feel so confident and might resent the slightest hint of proselytizing. So it's a fine balance between sharing one's faith versus the perception of pushing religion or theological ideas. Health institutions may have definite policies or constraints against any perception of proselytizing in the healthcare setting. So how can we broach it? Well, it's my belief that we can use the stories of near-death experiences as valid clinical phenomena that occur to people, and that they can provide a conversational bridge from the clinical to the spiritual. Because NDEs are actually, or near-death experiences, are actually clinical experiences. And a discussion of them with somebody is not pushing religious dogma, but providing valuable information about the experiences of others. These experiences are common, occurring in about 5% of the general population, believe it or not. It's that common. And discussion of them can open the door to other spiritual experiences or topics. So awareness of near-death experiences is a way to introduce the topic of death and to reduce the fear of dying in a way that I think is intriguing and hopeful. So this is what I say to people. Have you ever heard of near-death experiences? What we know from people who have come as close as one can get to dying and still have survived to talk about it is that the actual moment of dying is peaceful to the person dying, regardless of what it might look like to onlookers. And beyond that, it raises the possibility of a spiritual realm. You may choose to accept the spiritual possibilities or not, but we do know that the moment of dying is peaceful. The information we can give to others includes description of what is an NDE. Maybe the topic, do medical experts believe in near-death experiences? Some people say, I've heard there are medical reasons that could explain these experiences. Maybe they're due to delirium caused by infection or morphine. Is that true? Can it all be explained by the biology of the brain shutting down? How can some people see a spiritual realm? People might say, well, I certainly don't see a spiritual realm. So coming back to the beginning, what is the definition of a near-death experience? A near-death experience is a profound psychological event that may occur to a person close to death or who is not near death, but in a situation of physical or emotional crisis. Being in a life-threatening situation is not the same as a near-death experience. That is being close to death, but it's not a near-death experience. So a near-death experience is a pattern of perceptions that creates a recognizable overall event, and it includes transcendental and mystical elements. It's a powerful event of consciousness, and it is not mental illness. This is the definition from the International Association of Near-Death Studies. Simply described, I think it is the experience of increased consciousness when the person appears to be unconscious or clinically dead. And as I mentioned, they're surprisingly common, occurring in 5% of the general population and 18% of resuscitated cardiac patients. So why don't we hear about them more often? Well, people feel that they're very powerful events and they don't want to have their events trivialized or minimized or just ascribed to being, a delirium, for example. People say they feel like they're very private, personal events. So that's why we don't know how common, people haven't appreciated how common they are. Now, what a little bit about the story of near-death experience study. In 1975, Dr. Raymond Moody, who had a PhD in philosophy as well as a MD, reviewed cases of 150 people who had experienced these phenomena. The cases fell into groups of people who had cardiac arrests and were resuscitated, or people who came very close to death through illness or injury, and experiences of people as they died, as they were reported by the surviving relatives. So he wrote a book called Life After Life in 1975, which became a bestseller. It was featured in Reader's Digest, which was a very popular magazine at the time, and it influenced the movie industry. So these themes began appearing in movies, and it has resulted in a changed worldview about dying. Dr. Raymond Moody outlined that a near-death experience can contain some or all of about these 9 elements: a sense of great peace and absence of pain. The person may have been anxious and then suddenly feels very much at peace. They may feel that they're rising up or popping out of their body and floating above the body and watching events below them. So some people can accurately describe events that occurred in the resuscitation room. One of my patients actually told me about having watched the entire resuscitation process and which nurses were wearing which clothes and who did what. And people can report conversations down hallways, even with doors closed, and all occurring during the time that they were noted to be comatose or in cardiac arrest. After the person floats out of their body and maybe watches the scene below them, they then feel drawn towards a tunnel, and they travel through this tunnel of darkness until they reach a realm of radiant light at the end. We've heard about the light at the end of the tunnel, and maybe that's where this expression comes from. Some people don't report a tunnel, but they rise into outer space and see the Earth as it would be seen by astronauts. Dr. Carl Jung had this experience in a cardiac arrest, and he saw the Himalayas, he saw the whole globe bathed in a blue light. This was long before satellite kinds of photography, and he described seeing the entire globe. Often after people have gone to this other realm and come to the end of the tunnel, and they are met by deceased friends or relatives who greet them. Sometimes they're surprised that the person is deceased, and they said, "I didn't know that you'd crossed over." So they can learn new information this way. And the deceased people often glow with an inner light. Sometimes people are met by a being of light who is perceived as being loving, omniscient energy, identified variably as God, Jesus, or another spiritual being. And then the being of light or other spiritual beings present the dying individual with a panoramic life review in which the individual watches his life unfold and observes and feels the effects of his actions on others. People describe it as like a holographic kind of thing, or being in the middle of a theater that's in the round, and they can see their whole life around them. They're part of it, but they're also watching it. But as they watch each individual action, they see and feel the effects of their behavior on other people. And with this comes a realization that acts of love, even though they may be very simple little things, are of the greatest value in one's life on earth. It's not the great big things that people think are going to be recognized. It's the little acts of kindness. After that, the dying person may have a reluctance to return back to Earth, but might be told that he must return to life it is not yet time for him to stay. Some individuals are given a choice, but they choose to return in order to help loved ones. There are other elements that can occur in a near-death experience. There can be intense emotions, heightened perceptions. People describe intense colors that we don't even see here on Earth. There's a spiritual realm, which may include vividly memorable landscapes. Several people have described this beautiful lake with mountains around it. People have described to me a rose garden, similar to the one painting in behind me, where people feel that there's trellises and it's quite a beautiful place and a very peaceful place. People can sometimes have a life knowledge of the nature of the universe. They feel that they suddenly understand things from a greater perspective. There may be a sense of oneness and interconnectedness with the universe. Some people report a sense of having knowledge of future events. And some have messages regarding their life purpose. Some people have only one or two of the 15 elements often listed. In 1990, pediatrician Dr. Melvin Morse published a book, Closer to the Light, in which he described the near-death experiences of children. They're very similar to the experiences of adults, even when there's been minimal religious input. And I thought it was quite intriguing to read that a 10-month-old crawled up the tunnel, and the being of light has been described variably, but one child thought it was Santa Claus, because I guess the child thought that is the most ultimate in love. So this being of loving light must be Santa Claus. Near-death experiences are similar in individuals regardless of their age, their gender, their education, or their religion. And they've been experienced by people in every religion and even by people who are agnostics and atheists. Since Dr. Moody's work, there have been a number of physicians, psychologists, PhDs in various fields who've been involved in further research. And I've given a list of some of them who've contributed to the awareness of the field over the past 40 years. They include people from psychology, nursing, psychiatrists, including Dr. Peter Fennick, who's been very involved in the Spiritist Association, radiation oncologists, cardiologists, neurosurgeons, orthopedic surgeons. One place to get some further information is from the International Association of Near-Death Studies, or IANS, which has encouraged research in the field, and it provides annual conferences. Now, there have been attempted medical explanations for near-death experiences, and these have included delirium, maybe from sepsis or medication side effects, or psychosis, or maybe it's due to hypoxia. For example, if there's not enough blood supply to where the optic nerves cross, you can have tunnel vision. But in near-death experiences, people often have full perception from a much greater perspective. People think, well, maybe substance use is doing it, but this can't explain new knowledge about individuals or distant events or future events. People have talked about the DMT molecule, dimethyltryptamine, which is the active ingredient in ayahuasca. And people have talked about temporal lobe seizures. But there are differences between mental illness and near-death experiences. And I'm going to talk briefly about how near-death experiences actually differ from what I've just mentioned. And then we'll talk a little bit about the causes. Dr. Bruce Grayson talked about how the clinical presentations are so different in context, in that they occur, in the content, in the memory, and in the after effects. Near-death experiences definitely differ from delirium. I've seen thousands of cases of delirium in my career, and I've talked to many people who've had near-death experiences. They're definitely very different. A delirium is altered functioning of the brain due to an acute medical condition or substance intoxication or withdrawal. And it's a disturbance of attention, concentration, and a disturbance of awareness. People are disoriented to time or place. It occurs rapidly over days or hours, and there are changes in thinking and perception. There may be visual hallucinations, confused or muddled thought processes, and the thoughts aren't really processed very well for immediate recall, and people have minimal recall later. We also see psychomotor changes, sleep impairment, and emotional disturbances with rapidly changing emotions. And they're not due to dementia, but a sudden change. Well, how does delirium differ? Well, delirium can be explained by an illness affecting the functioning of the brain. But a near-death experience, we can't explain these features beyond the triggering circumstances for what caused the loss of consciousness. We can't explain how illness or impending trauma created the experience. How can impending trauma have the same effects as the actual illness? And dreams of dying can also create similar experiences. But there are some things we can't explain biologically. Awareness of non-local events while a person is unconscious. We can't explain that. Delirium symptoms fluctuate over time and in intensity. Near-death experiences are all or nothing. Externally, the person looks to be in a cardiac arrest or coma, and then later is fully conscious, while internally, the person is fully present and may be observing things. In a delirium, the person is very sick with partial awareness, partial ability to interact. In a near-death experience, they're completely unresponsive, and there are no interactions during the experience. In a delirium, people are muddled. Thinking is fragmented and lacks consistency. There can be a shifting of paranoid ideation. So I would call it a muddled mess. But in a near-death experience, the experience is coherent. It may sound fantastically imaginative to uninformed others, but it holds together in a congruent way. In a delirium, there are false ideas and misinterpretations of identities of others. I always laugh about the experience of hearing that one patient told me. He was a non-criminal patient. He said, "Oh, I remember you. I know you from our bank heist together." So that was news to me. It still makes me laugh. And the content is often distressing, fearful, paranoid when people are suspicious of others. They misinterpret the intent of others as being harmful. They may think that the nurses or the doctors are trying to harm them. They may or murder them. They may feel misunderstood. The content is never inspirational. It is not about being loved or valued, ever, that I've seen. In contrast, a near-death experience content tends to be very inspirational, with the focus on being understood, of being valued, and of being loved, and of having a purpose for being alive or having a life. In a delirium, psychomotor activity is often agitated or hyperactive, or can be hypoactive, but in a near-death experience, the person looks comatose. In delirium, a person is labile, fearful, or bland, and while recovering, whereas in a near-death experience, there are no emotions during the event, but later people express awe, humility, possibly gratitude, increased self-confidence, determination, and with sustained emotions. Delirium, people have poor or little recall for the event. Often they don't recall anything other than that they were very confused. The content was poorly processed and stored, so therefore it can't be retrieved. In contrast, in a near-death experience, people have excellent memory for details of the experience. The memories last over time, so there is a lack of memory decay. Delirium, generally, there's little impact on the subsequent life, aside from fear of getting that ill again. People say, "What a nightmare. I don't remember much, but it was awful." I have never observed after a delirium any positive impact for life purpose or dedication to a cause or decreased fear of dying. In contrast, after a near-death experience, people typically live with more intention in life purpose, with a greater desire to express love to others. They're more philosophical about transient life circumstances, and they're less fearful about dying. And there can be double presentations where a person can be somewhat delirious, clear, and have some spiritual experiences, and then become delirious again. A companion of mine commented to me on the day prior to his death, "Elaine, I thought I was walking down a street and I came to a place with a lock on the door. I opened the lock and you won't believe what's on the other side of that door. It's amazing, a whole other world." I also had a patient who told me one day when I went to see him, he said, "I had a dream last night. I suddenly opened a door and there was the whole universe." Very similar. Now, temporal lobe stimulation can create an experience partially like a near-death experience with feelings of love, expansiveness, and unity with creation, but it doesn't explain all the facets of a near-death experience, such as new knowledge about people, discovering that someone's died, or new information about relatives, or it doesn't explain detailed awareness of same-time events or conversations elsewhere that were later verified, and those are called veridical events. That they were verified. There may be new knowledge of past or future events. What can't be explained by biological theories is presented in a book called Evidence of the Afterlife, The Science of Near-Death Experiences, written by Dr. Jeffrey Long, a radiation oncologist with best-selling author Sir Paul Perry. And they outlined 9 lines of evidence that counter any offered single biological theory. First of all, of the 9 lines of evidence, the level of consciousness and alertness during a near-death experience is usually greater than that in everyday life, even though the person is medically unconscious. This alone is medically inexplicable, no matter what theory is entertained. How can somebody who is in a cardiac arrest know something on the other side of the world or in a conversation a few blocks away when they're in a cardiac arrest? We can't explain that. They might see and hear events later verified by others, as I've just mentioned. Some near-death experiencers who were blind or significantly visually impaired had near-death experiences in which they had normal or supernormal vision, even if they were born blind. We know that near-death experiences can occur under monitored general anesthesia at a time when conscious experience should be impossible. We know from the charting that they were unconscious at that time. Life reviews include real events that may have been forgotten or previously unknown to the person. They might learn new information during their unconscious state that they did not know prior to their near-death experience. Another interesting line of evidence is that when they encounter beings they have known, the beings are virtually always deceased. You would expect that if they were memories from the subconscious, they would include living relatives. And sometimes they learn of the death of a relative and that had been unknown before. We know that near-death experiences of children not exposed to religious doctrine are strikingly similar to those of older children and adults. These events are consistent around the world in spite of different cultures, and they create powerful after effects and motivate people to change their lives. An additional 10th line of evidence is from the field of exploring shared death experiences, in which a healthy person shares some of the spiritual experience of the dying person. There may be a shared vision by those who are physically near, such as at the bedside of a dying person, where the healthy person also sees spiritual energies, such as a divine light or energy movement. Dr. Jeff O'Driscoll, emergency physician, describes his own experiences in his book called Not Yet. It's an excellent book. In another program, a shared crossing pathway program by William Peters in Santa Barbara, California, he talks about shared perceptions of the dying process by people who are emotionally close to the dying person. not necessarily physically close. Harvard neurosurgeon Dr. Eben Alexander wrote, "Like many other scientific skeptics, I refuse to even review the data. I prejudge the data because my limited perspective failed to provide the foggiest notion of how such things might happen. Those who assert that there's no evidence for phenomena indicative of extended consciousness believe they know the truth without needing to look at the facts." But he said the event that was most convincing to a skeptic was to have an experience. Well, if there is a spiritual realm, why can't we see it? Well, I was thinking about this and thought of those magic eye books that many of you have seen, and there's a picture of it on my slide. And these books are a series have pictures of dots and different fit lines and squiggles. And you put the book right up to your nose, and as you slowly move it back and kind of stare through the book, all of a sudden a picture starts to emerge. It might be a circus or sea life, or it could be any scene. But everybody who looks at that same page will see the same scene. Some may have it just vaguely, others may have it very intensely, specifically elaborated. And it seems that there's a sweet spot in your focal point for seeing that scene. And if you blink, all of a sudden it's gone and you just see dots again. So is there a sweet spot for a focal point for seeing the spiritual realm? I think, this is my theory, that small children still have the ability to see spiritual beings until age 3 or 5 because they have a greater ability to shift their focal point. But as they adapt to living in the physical world, they need boundaries to know what's a physical object and who's actually a person in the physical realm versus a person or an energy in the spiritual realm. And so otherwise they would be at risk for harm. You could sit down on an imaginary spiritual table, perhaps. I'm just being facetious, but you get my idea. And perhaps as the child adapts, they need to know where the boundaries are of material objects. So perhaps the ability to flexibly move one's focal point visually is generally lost as we mature. And as we do that, we don't see the less dense spiritual energy. But we also know that people who are dying do see spiritual energies. So it seems that there is a softening of that focal point at both ends of the spectrum, as when we're first come into this world and as we leave this world. In fact, a quick story, my own mother, when she was dying, I asked her if she could see anybody in the room, and she nodded. And I said, "Oh, do you see your parents?" No, she shook her head. She was barely able to talk at this point. But I said, "You do see, do you see my dad?" "Yes." "Do you see your parents?" Again, no. "But you see dad?" "Yes." And a big grin on her face. And she died a few hours later, but she was happy. She felt that he was there to escort her to the next realm. And that was a very comforting thing. It was comforting, I think, for her that I acknowledged that. She couldn't talk to me about it, but that I asked her the question. And so I could share with her the process that she was experiencing leading up to her passing. Dr. Jeff O'Driscoll speaks of the veil parting for newborns and for dying, with the light of glory more visible to others as the curtain is opening. So I wondered, maybe there's specific frequencies in certain parts of the brain that allow us to see the spiritual realm at times. Now, Dr. Peter Fenwick has written a fascinating book called Shining Light on Transcendence, The Unconventional Journey of a Neuroscientist. And this is a fascinating account of his research assessing brain energy and the anatomical locations during spiritual activities. And he was using EEGs and functional magnetic resource imaging and magnetic encephalography. And it's the first neuroscientific evidence underlying the experience of sending externally observed light energy from one person to another, and the coupling of the sender's energy and the recipient's brains as they studied them during the light-giving process. So one person was giving light to a light energy to another. And when an individual sent spiritual energy to another, the sender's brain was in a higher metabolic state, and especially the left temporal area. So something was actually happening in his brain. And moreover, there was a coupling of the sender's brain activity and the recipient's activity, with the brains acting simultaneously with each other, even through closed doors. But it was very interesting. There was no communication between the brains when both wore goggles. And as I read this, I wondered, are the eyes the windows to the soul, window to the soul? And perhaps maybe they're a transmission doorway for telepathy. It's fascinating to think about. So I'm not suggesting that explanations of spiritual experiences can be reduced to simple brain functioning. On the converse, I'm suggesting that scanning techniques suggest that our nervous system is hardwired for some capability to access and to indicate the presence of spiritual energy and of a spiritual realm. Okay, well, now I'm quickly want to move on to practical tips for approaching the topic of dying. So my colleague, looked at my slides and talk, and I thought, well, it explained all about near-death experiences and what he could tell his dying cousin about dying. But then he said, well, how do I start? What do I say? And I thought, okay, I'm going to have to go back to the basics. I didn't explain it clearly enough, because actually it is an unnerving thing to introduce the topic. And so right back to the very beginning, my first question would be, how do you feel? Are you worried? And I know that sounds like a typical psychiatrist kind of question, but it is a valid one. You could say, what worries you? Is it the fear of pain? What is it that's upsetting you? Is it the fear of not seeing people, or the fear of dying, the fear of the unknown? I wouldn't put the words into their mouths. But those are things that you might be thinking of, and you might guide the conversation that way. You can also ask questions from the HOPE questionnaire, and it uses the letters HOPE to guide you with the questions. H stands for hope. What gives you hope? O, were you raised in any particular religious organization? And do you follow that now? P, do you have personal practices and beliefs? Do you believe in God or in an afterlife? E, do you have end-of-life concerns or worries or practical issues? This was a model developed by physicians to guide spiritual assessment in medicine, and this is the reference for it from the American Family Physician in 2001. So before I start into the next slide, I'd just like to say that I work on the leukemia ward, and people are very frightened. And so it really helps me if I just say, what gives you hope? And when I'm asking about these personal beliefs and practices, like, it's really important. Do you believe in a God or higher power or spiritual realm? Do you believe in an afterlife? Because that is a very basic thing, and it helps me to guide the direction of further conversations if someone becomes terminal in their illness. And then I talk about near-death experiences, and I'm going to repeat this. I said it earlier, but it's so important. That's why I'm repeating it. What we know from people who have come as close as one can get to dying and still have survived to talk about it is that the actual moment of dying is peaceful to the person dying, regardless of what it might look like to onlookers. And beyond that, it raises the possibility of a spiritual realm. You may choose to accept the spiritual possibilities or not, but we do know that the moment of dying is peaceful. We can emphasize the contrast between external observations and internal experience of the dying person. There's an example of a man, Daniel Brinkley, who's written a book, who was electrocuted, which might have looked quite violent to an onlooker witnessing what his body experienced. And yet what he described was a feeling of utter peacefulness with the sound of chimes and an orderly quality to the experience. So I've used his story as a very helpful one, that whatever it might look like on the outside, we know that for the dying person, the experience feels very peaceful. This was an important story for a man who observed his teenage son suddenly having a heart attack and collapse towards him. the father actually relived that memory over and over again in a form of post-traumatic stress. And I was able to tell him about this, about near-death experiences, even though the man had been atheist, and that what his son was experiencing was probably peacefulness and probably watching this from above as it was happening, and that he would have moved on in the spiritual realm, and that he wouldn't want his dad to be stuck over and over in that memory. Just like in childbirth, people can have memories of the actual process, but then they move on and onto things further from that. So that story of Daniel Brinkley was pivotal in the father's experience. And in fact, he began researching the topic and decided he wasn't an atheist after all. We can offer reassurance to people who are dying. And we know that it is common for the dying to see visions or dreams of deceased loved ones arriving to welcome and escort them to the other side. And we know this from the research of Dr. Christopher Kerr, who has given a TED Talk on the topic. And I've mentioned my own experience with my mother. So what I do is I ask, have you had dreams or visions of loved ones who have passed over, coming to see you? Reinforce the elements of welcoming by loved ones and of celebrating. It's going to be a great celebration on the other side. A quick story about a woman in a hospice who was dying, and I felt I suddenly had to go and see her. And she felt she had a couple of weeks left. I asked her if she'd had any dreams, and she said, well, it's interesting you ask. My brother, who died a few years ago, has been appearing. And I said, well, he's waiting to celebrate with you, and it's going to be a great celebration. I told her about near-death experiences. I quoted the lyrics from the African-American spiritual Going Home, and I suggested that her husband download the song's lyrics the next day. Well, she fell asleep a few minutes later in a relaxed and happy state, and actually never woke up again. She died in her sleep that night. It was amazing. It was, I think, a divine appointment. I'm sorry, I'm a little emotional, that I was actually felt I should go see her that evening, because it really did help her transition, I think, and she went very peacefully. But sometimes you can lead a horse to water, but you can't make it drink. I had a friend who was an atheist and said, don't anybody dare to convert me on my deathbed. So I happened to be with her when she was dying, and I used happy memories of evening bonfires, enjoying the beauty of the light and happiness of being surrounded by loving friends. Another patient said, I believe in science and I don't believe in God or the afterlife. I said, well, there are many scientists who actually do believe in God and are interested in near-death experiences. If you ever want to talk about them, I'd be happy to share those stories with you. But she didn't want to, and I wasn't going to push it. That would have been a betrayal of trust in me as her physician, and I didn't want to go further if she wasn't willing. So we can use metaphors to suggest hope, however. For example, metaphors of travel. How did you feel before leaving for Africa? Were you a little apprehensive? How did you feel when you arrived? It must have been hard to imagine before you got there. And, oh, you had an exciting adventure, a great time when you were there. So if that person had been to Africa, that would be a great kind of line to use if they're now dying, because it would reawaken that memory of excitement of going somewhere new and not knowing where you're going, but still it turned out okay. We can use metaphors of light, as I did with my friend. Wasn't the firelight beautiful? And we were all surrounded by love and the love of friendship, friends. Those were great times, weren't they? We can talk about celebrations of past get-togethers. So I want to move on now to the story of Lisa. She was a 28-year-old young woman who had minimal beliefs, who had a recurrence of her leukemia and was dying. She said to the staff, what happens when we die? What's it like to die? I don't have any idea. So the palliative care staff were called, and they described in clear detail the physical changes of dying, that she would have changes in her breathing, she would become drowsy, and that was it. Well, she was terrified. And she became very anxious. And so I was called in as a psychiatrist to come see her and to deal with her anxiety. And so she told me what had happened. And I said, were you told what it actually feels like inside or psychologically to die? You know, from accounts of people who came as close as you can get and still talk about it. She said, no, no one mentioned anything like that. They just talked about my breathing. And so I said, well, it's a good thing that I'm here to tell you about these stories. So I told her about near-death experiences and different stories of what people had experienced. And that changed everything. The next 3 weeks were transformed from terror and macabre images of being in the grave to hoping for a celestial reunion with her uncle and a great celebration. And she and her husband were able to talk about her journey and that she would see him at a future date sometime. I also talk about dream equivalents of near-death experiences and their role in diminishing fear of dying. Sometimes people have dreams about it, and these dreams are very similar. I've mentioned a little bit about the shared death experiences. William Peters, he has developed protocols that assist couples where one of the one of the persons in the couple is dying. And these protocols reinforce the connection within the couple. And their research data indicates that the use of their protocols gives increased likelihood of a shared death experience, of visions or dreams or telepathic communication at the time or shortly after. I now like to talk about one of my patients, Jackson. Actually, the patient was his mother, Mary. She herself had had many, many physical problems of a brain tumor and a leukemia and a stem cell transplant. She also was coping with her 40-year-old son, Jackson. He had overdosed repeatedly with several cardiac arrests that had led to severe brain injury, seizures, and an ICU admission. He had been adamant for years that he wanted to leave this life. Major attempts for intervention, hospitalization, and treatment had been unsuccessful. She now was worried he was suffering even more because now he was in the ICU with a severe brain injury. And so this was worse than when he was fully physically well and yet wanted to die. He had said before, I want to die. The pain is always there inside me, ripping and tearing at me for years. And again, after his most recent episode. When he was in the ICU, he kept saying, help me, I want to go. He had fluctuating ability to communicate. They had to decide at some point whether to give him a feeding tube because he was no longer able to eat. He'd been in the ICU for about 42 days. A decision had to be made whether to put in a feeding tube and keep him going or whether to not put in a feeding tube, in which case he would be moved to hospice. She and I discussed this along with her husband, and we felt that the decision would be to not have a feeding tube, as that would be consistent with what he wanted. Even though she, of course, didn't want to say goodbye to him, and she had had strong Christian beliefs against ending one's life or any involvement that way. She had guilt and ambivalence about the decision to discontinue life support and for him to be moved to a hospice bed. She said to me, what should I say to him as he goes to hospice? So I was involved because I'd actually also tried to help him get support in previous months and was frustrated, and he wasn't my patient. I just tried to access the system, which can be frustrating for many people. So I had also met him. And so I knew him, and I had to think, what could she say to him? Well, tell him how much he is loved and will always be loved. Loved in this physical life and loved in the next realm. He's surrounded by love here, and he will be surrounded by love in the next realm. Ask him if he's had any dreams of visitors or has seen others nearby to welcome him. Well, apparently he wasn't able to respond, but she did ask him. I stressed that leaving this body would be a relief and would be peaceful. I talked of possible celebration on the other side when he arrived. She showered him with love for the 42 days of his life after the overdose, and he died, quote, according to her, peacefully as I had hoped. She had been conservative Protestant Christian, but now was less rigid in her beliefs. However, she still worried that he might be punished in hell for his suicide attempt or for his loss of faith. Well, what helped his grieving parents? And this is based on my own experience with them. And sometimes I felt too that I was kind of walking through the dark and asking for help. Help, what should I say to them? That's the best thing to do. And divine intervention will put something into your head to offer some kind of response. I said that she had walked alongside him. And I actually hoped I was walking alongside her as a witness to her suffering without glib attempts of reassurance. I wanted to listen and allow her to debrief. I didn't want to say, I know how you feel. Jackson's father felt overwhelmed by grief and guilt about having been angry at his son. But long before, for his behaviors before the last overdose. We discussed anger was a natural reaction to his behaviors, and anger would be realistic in the context. It was natural also to feel guilty about the anger. Jackson's mental illness had been subtle, confusing, and ambiguous, which made it difficult to understand or to accept his behavior. So I stressed there needed to be compassion for Jackson and compassion for themselves. We are all imperfect. Life is harder for some. They loved Jackson and he loved them. And the change in the relationship that he was now had moved on did not erase the presence of love. Jackson knew in his soul that he was loved. There was also a discussion about the parents' grief in that the mother had long-standing but now ambivalent Christian beliefs. But she was interested to hear what I had learned from near-death experience stories. We discussed many of the features and applied them to Jackson. He was now free from the constraints of mental and physical illness. He wanted freedom. Perhaps he was enjoying new vistas and adventures and glorious colors unseen on earth. He had loved photographing nature, so she thought this would appeal to him. She commented, it's helpful to consider where he might be spiritually at present. Possibly he observed and appreciated the very thoughtful tribute to his celebration of life held outside in nature. She read at the service, remember a grave is only a curtain for the paradise behind, by the poet Rainer Maria Rilke, which resonated with our discussion of the veil between this life and the next realm. She had also worried about punishment and the possibility of hell. We discussed the concepts of earthly life as school for the soul, and that the life review in near-death experiences emphasizes a loving assessment of what was learned from the life experience on earth, rather than a perspective of punishment. We also talked about depression and how that can diminish faith. That's my clinical observation. Surely God wouldn't punish him for a symptom of depression. As she said to me, this is all very comforting. Near-death experience stories suggest that we are not alone. Our struggles are not unnoticed. There are biblical quotes that God sees all, but they can take on a more vibrant meaning when reinforced by the near-death stories that indicate that there is a spiritual realm and that our struggles are seen, perhaps by countless spirits, angels, or transitioned friends. I said to Mary when she felt isolated, lonely, and despairing, you may think that your suffering's unnoticed, but NDE stories suggest that your life might be actually on a stage that seems as if it's empty. You might be in the dark, but there could be several thousand of souls in the audience, perhaps like at Carnegie Hall, who are absolutely cheering you on and shouting, you're doing a great job, you're doing a wonderful job, keep going, keep going. So that really helped her. We also talked about the question, why do we suffer with excessive extreme challenges? Mary wondered at times if she was being punished. After all, she'd had so many traumas of deaths and the brain tumor and leukemia and a transplant and loss of an eye. It went on, and then now the death of her son. Well, we talked about what we knew from the life review, and that our journey on life is to experience life and to gain perspectives. Perhaps Mary, with her excessive extreme challenges, was a student in the accelerated program. No grade 1 pro year for her. She was actually working on the PhD program of life. So this comment brought humor, acknowledgement of the degree of stress she'd had, that I was aware that life had been incredibly tough, and a new spiritual interpretation for the extreme medical challenges and family anguish in her life. She was going to advance very quickly. So we can use near-death experiences therapeutically in many ways. I've talked about different themes. We can also use them to teach patients who are grieving their own anticipatory losses. Jackie was a born-again Christian who was dying and was extremely worried that after her death, she would never see her beloved husband in heaven, as she believed that he would not be saved due to his different belief system. So I'm summarizing the slide. She talked to her pastor, who agreed that he would not be saved. He didn't have the right belief system. So she went to her family doctor, who didn't have the time to sort out religious belief systems. In talking to me, I discussed that many Christians had had near-death experiences. And so we talked about that. And I suggested that she needed to consider thinking outside of the box, and that as she loved her husband, likely God also loved her husband. And perhaps God had some loving solution beyond what our little minds could conjure up about heaven. This satisfied her, and she died with greater peace of mind. You know, I say to people sometimes, we're just like little earthworms crawling along the ground. We don't see much. You know, a little stone looks like a huge boulder, but we see very little compared to what the butterfly sees. We do need to ask about suicidal ideation with people who are very anxious, and we can use near-death experiences therapeutically in these contexts. Ask, even in non-psychiatric settings, if a person's having suicidal ideation. For example, for me, I talked to a mother on the leukemia ward with chronic life-threatening blood condition. She was fatigued, battle-weary, had low self-esteem, no life purpose, strained marriage. Another one was a young father who was maritally separated, stating he would kill himself if he told his condition was palliative. So a person doesn't have to be in a psychiatric setting to have suicidal thoughts. And you need to trust your intuition if you're worried. And you can say to that person, it may feel as if it's hopeless, even though the reality is not hopeless. It may feel as if it's hopeless. And also, harming oneself could be a disaster of permanent effects for what is likely a very transient situation or transient mood. But if you are unsure, please call the emergency service, 911. With suicidal patients in the emergency room, I tell patients there is a spiritual realm, that they are loved, that our lives do matter, that loving others is most important. Young children need to know they're loved. As I said to that young father, your daughter needs you. Exiting early could send a lifelong message that she was not worth living for, or that she wasn't valued enough. And with that statement, he decided he was going to live right until he died from his terminal illness. And that's what happened. And his daughter saw him as a hero. I must say that working with patients like this over these years, it does not make me immune to the emotional aspects of it. So I apologize for being a little bit emotional, but they are real people to me. And I have said to people that if they do consider suicide, what if you get to the other side and you say, oh my gosh, now I have to redo all of this, all my pains and challenges. I'm still aware I've made a mistake, but it's too late now. There is a story of Sandy, a practical nurse who shot herself in the chest and learned from her near-death experience that if her suicide was completed, she would have to relive her pain or challenges starting from the beginning and up to the point of committing suicide. And she said, I wouldn't be saving myself any pain. I'd had so much pain and I didn't want to go through all of that again. So I discussed that story with another patient of mine. The following week, my patient came back and said, I'm not thinking of any suicidal thoughts now. I don't want to go through all of this trouble again. So using the story of Sandy has been very helpful for me with patients. However, with a mother of a patient who's committed suicide, you might want to say, well, it's like a student, your child dropping out of school early. It might have consequences. They don't go on forever. It might be easier to just stick with the program and not exit early, but it doesn't mean that things are devastating forever on the other side. So I guess you have to temper the stories with the situation, the context of the person that you're dealing with. We can give hope that, as one mother said, each day I can live longer is one more day my children have a mother. And I never forgot that mother saying that, and I've used that story with others. We can demonstrate being a hero to children as leaving a legacy. Our actions matter. Each additional day lived might be just enough for a new drug or cure. And antidepressants can also help to increase resilience, often within a few days. I'm going to move ahead a little bit. There are offshoots of near-death experiences in therapy, of shared death experience therapy, of reincarnation-based therapies, of afterlife communication therapy approaches. This is a slide of reincarnation therapies from Dr. Brian Weiss and Dr. Linda Bachman, that they use clinical hypnosis and patients recall past lives and lessons learned. Afterlife communication therapies are when people undergo experiences in therapy using EMDR techniques and simultaneous hemisync sound, and patients have an increased sense of the presence of deceased loved ones, about 85%. We don't understand the mechanism. Is the frontal lobe overwhelmed and other parts of the brain become more active in processing? Is there a brainwave frequency change, accessing frequencies of spiritual energy? Is it hypnotic suggestion? I don't know. I'd like to move on finally, that we need to be teaching about near-death experiences. It is often almost a taboo subject. It's not a regular topic in medical schools, in residency or training, in psychiatry programs, in trauma or emergency room. I went and looked at a library of in a palliative care ward, and the books were 98% about grief, about loss, about the finality of death. It was actually pretty depressing. It may have been helpful for the caregivers, certainly not for the patients. And I wondered, why has it been a taboo subject? I think there's fear that it could be politically incorrect to discuss, quote, religion or spirituality in medicine. There's a mistaken idea that acknowledgement of a near-death experience is religious proselytizing, even though it is a common experienced phenomenon. It's not a religion, it's a phenomenon. It is, I think there's fear that it is not scientifically understood and should therefore be ignored. And I think there is lack of awareness that it is a profound experience that has psychological and spiritual consequences that should be acknowledged and studied by health professionals rather than ignored. Now, I was asked to go to a palliative care ward, and there were 2 young anxious patients who were frightened of dying. They were anxious with panic. They were given Ativan and told by spiritual care person to focus on their breathing. But one of the patients became very anxious because it increased her anxiety that she soon would not be breathing. There was no mention of near-death experiences. And I thought, wow, we could offer so much benefit to these patients from teaching about NDEs. We don't withhold other treatments when they have benefit. And I thought, is withholding information about the NDE topic a form of medical incompetence? If suffering could be reduced if we did talk about it? I talked to those individuals about near-death experiences, and the woman, young woman said, oh, could I stay a little bit longer? Oh, a little bit longer. Oh, I want to know more. Oh, this is so helpful. Oh, thank you for telling me this. And she had a good night's sleep and settled. It was much more effective than telling her just to focus on her breathing. So there are places that we can teach or recommend getting information from IANS, from their website. There are videos, the near-death experience, what medical professionals need to know. There's Life After Life video by Peter Shockey based on the book by Raymond Moody. There's the video Afterlife by Paul Perry. We can all do our part. The ripples go out. To healthcare professionals, we should be bringing NDE teaching throughout medical settings and to medical schools. But we don't need to be part of a healthcare profession to spread the word that dying is not to be feared. And I'd like to finish by saying that awareness of NDEs is a way to introduce the topic, to reduce the fear of dying in a way that's intriguing and hopeful. And as one woman said, I feel a bit anxious, but then I'm always a little bit anxious when I start a new journey. And as Dr. George Ritchie said, death is nothing more than a doorway to get to the other side. Life goes on forever. So thank you for your time and interest. And these are my contact numbers in Vancouver, BC, Canada, where I can be contacted. Thank you.
Thank you very much, Dr. Drysdale. Thank you very much for this fascinating talk. And I have heard many people talking about NDEs, but your talk is especially interesting for the vast clinical experience that you were sharing, and also for the approach, the therapeutic approach that you give to NDEs in different settings, helping patients who are undergoing physical or emotional crisis, helping relatives of dying patients, helping people who have suicidal ideation. All these are very, very inspiring and interesting types of ways we can use the NDEs awareness. So I think this is going to really be helpful and inspiring to several of healthcare professionals watching this. I also think that it's very interesting the differences between the characteristics of NDEs and mental health issues. That's also very, very important for us. And I think that, you got emotional talking about your patients, and that can only show how compassionate a doctor you are. So your patients are very, very fortunate to have you as a doctor. And so finally, we want to thank you again for your great contribution to our program at this first virtual Congress of the International Spiritist Medical Association. Thank you.
Thank you.